The field of interventional cardiology is changing rapidly, and fellows are at the forefront of it all. On Fellows Forum, we want to know how you plan on leaving your mark. So I'm here at CRF's 2015 Fellows Course in Miami, Florida, asking, where do you see yourself in 5 years?
I'm very enthusiastic about research and academic activities, so I'm seeing myself involved in one academic institution around the country. I have a background in stem cell research and applying stem cells and new modalities for heart regeneration in an invasive way to the heart, and I'm looking to develop new methods, new technology with my interventional skills to that field.
5 years from now, I'll be 3 years out of training. So hopefully some of these famous guys that are running the conference today will decide it's time to retire and leave an academic spot. And what do I mean by that? I'd like to do some teaching. I'd like to have a little protected time for research and do what I trained to do interventions.
In 5 years, I really hope to stay in the academic arena, especially, I really want to be in a place where I can encourage other women to really go into cardiology, especially interventional cardiology, because I did, a study previously where I had won this Women's in Training, Fellows in Training Award for AHA, and I realized that, of all of the cardiologists in the United States, only 14% are women. And of that 14%, only 7% go into interventional. So I really think that this is something I'd like to encourage other women to do, and I feel that I can only do that in the academic arena.
I'm pretty open to several avenues in terms of my practice, but in terms of like the 5-year plan, I'm hoping to start as junior faculty at that point, apply for research grants, see how that works out, and then kind of create a dual path where I'm like honing my skills as a structural interventionalist, but also as a researcher.
Hopefully, I'd like to get a job that's 70% clinical work and then 30% innovation. I like medical product design, and hopefully we'll be working at an academic institution doing some medical product stuff, design stuff, and then work also with residents and fellows teaching, doing in my clinical time.
I'm joining Interventional Fellowship in July at Salt Lake City in the University of Utah. So that's a baby step I take. So it's 5 years is a long time. Right now, I do not know is my honest answer, but I have an idea. I think the idea is that I want to be an interventionalist, very active in the field.
I see myself probably in a semi-academic, semi-private practice, trying to manage to become as proficient as I can with all the interventional techniques, and hopefully by then try to master in one particular area so I could be the person who does that particular thing in my institution.